Bengaluru 20th May 2026. A major leap in advanced robotic healthcare has arrived in Bengaluru as Aster CMI Hospital strengthens its neurosciences program with the introduction of two next-generation robotic surgical systems, Mazor X for spine surgery and ROSA for complex brain and cranial procedures. The hospital has now become one of the leading centers in India offering highly advanced robotic-assisted neurosurgery focused on precision, safety and faster recovery for patients undergoing critical brain and spine treatments. One of the biggest breakthroughs introduced through the ROSA robotic platform is frameless brain surgery technology, a revolutionary advancement that changes the way neurosurgical procedures are performed. Traditionally, many brain surgeries required rigid frames fixed to the patient's skull for surgical navigation, making procedures more invasive and uncomfortable for patients. But with the advanced ROSA frameless robotic system, surgeons can now achieve sub-millimetric precision without the need for traditional frame-based methods, significantly improving patient comfort, surgical accuracy, and efficiency. The ROSA robotic platform supports highly complex procedures including brain tumor surgeries, epilepsy treatment, stereotactic neurosurgery, and movement disorder interventions while helping surgeons preserve critical brain functions with greater precision. Alongside this, Aster CMI Hospital has also introduced the Mazor X robotic guidance system specially designed for advanced spine surgeries. The Mazor X platform helps surgeons perform detailed pre-operative planning and highly accurate placement of spinal implants, reducing the chances of human error and supporting minimally invasive surgical techniques. The robotic technology also helps reduce radiation exposure, smaller incisions, reduced blood loss, shorter hospital stays, and quicker rehabilitation for patients recovering from complex spine procedures. Dr. Ravi Gopal Verma, Director, Aster Global Center of Excellence in Neurosciences and Lead Consultant Neurosurgery at Aster CMI Hospital, said that the introduction of Mazor X and ROSA robotics marks a major milestone in advancing neurosciences care in India. He stated that the frameless capabilities of ROSA are transforming brain surgeries by improving precision while making procedures less invasive and more comfortable for patients, adding that these technologies allow doctors to achieve exceptional surgical accuracy in highly complex brain and spine surgeries. Dr. Akshay Hari, Consultant Neurosurgery and Spine Surgery at Aster CMI Hospital, said robotic-assisted spine surgery with Mazor X enables detailed planning and extremely accurate implant positioning, which is critical in complex spine procedures. He added that with enhanced precision and reduced tissue damage, patients can experience faster recovery, reduced pain, and improved long-term outcomes. Commenting on the development, Dr. Prasad N, Chief Executive Officer, Aster Hospitals, Karnataka, said Aster continues to invest in advanced technologies that redefine patient care, and the addition of Mazor X and ROSA robotic systems further strengthens the hospital's neurosciences program, bringing world-class technology-driven healthcare solutions to patients across India and beyond. With the integration of robotic-assisted neurosurgery, Aster CMI Hospital continues to expand its advanced neuroscience ecosystem, combining clinical expertise with cutting-edge technology to deliver safer, smarter. The advanced robotic technologies were inaugurated by former Indian cricketer and President of Karnataka State Cricket Association Venkatesh Prasad. Senior management officials and leading medical experts from Aster CMI Hospital were also present during the occasion.
event is a landmark event. Here, Aster Neurosciences and the Aster and the Aster Group have invested in a two very important and latest technologies, robotic technologies, and these technologies are first of its kind in India. For example, the ROSA, which is the brain component of the robot, is probably, this model is the first outside the US, and first of course in India, and this gives us precision to place electrodes to do surgery in the brain. And we all know we need to be really precise where the brain is concerned. And the other robot is the spine robot. Lot of precision is the in thing in the spine robot, where the placement of screws going to those lesions, to those levels, are made much more precise and faster. Patient care is much better, the outcomes are much better.
What is the success rate?
These are new technologies. They have a very high success rate. In fact, as I told you, this sort of combination is the first time in India. So we are here to develop more. All over the world, it has shown as it's a very accurate and very precise technology.
And how it is used in Indian, especially in medical science?
So the brain robot is used in certain very delicate surgeries called deep brain stimulation, where we have to go into the center of the brain, very small nucleus, maybe a few millimeters in size, accurately to place it there. So the conventional method, we do it but with frame. Here we can do it without the frame. Robot, we put the planning into the robot, and the robot tells you where to go. So very precisely we are able to place electrodes. Similarly, certain areas of the brain we can precisely place it, and precise surgery can be achieved. Similarly in the spine also. Lot of spine surgeries happen. We have seen there are a lot of failures in spine surgery. All that can be minimized and reduced with the advent of robotic in spine.
Indians are middle class people. Normally, basically, surgery is a true cost. How it is possible to given the
So we look, every patient does not require robotic. There are specific people who require. We will convince them that this is required. And the cost factor is under our control. We can help them. It does not increase the cost very much. There's a marginal increase because we are using this technology. But it is not. Only when it's mandatory and when it is useful, then only we will use it. In certain patients, we may not use it at all. But when it's required, we give the option to the patient saying this is required, the accuracy is much better. They can take a decision. So we do both robotic and non-robotic. But robotic gives more accuracy and more advantage for the patient.
This is the only one hospital apart from the US doing this facility.
This particular robot called ROSA 3.1.7 is the first in India, first outside the US. US there are about 50 such robots. But in India for the first time we are hanging outside the US first time. Similarly for the spine also. The thing about spine surgery is the combination of O-arm, robotics and minimally invasive. Nowhere in the country they do it. It is only here.
ಸರ್ ಇವತ್ತು ಹೊಸ ತಂತ್ರಜ್ಞಾನ ಆಸ್ಟರ್ CMI ಹಾಸ್ಪಿಟಲ್ ಅವರು robotic ಕಾನ್ಸೆಪ್ಟ್ನ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ್ದಾರೆ. ಯಾವ ಬಗ್ಗೆ
ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಒಂಥರ ಖುಷಿಯಾಗುತ್ತೆ ಇಲ್ಲಿ ಈ ಥರ ಒಂದು ಇನಿಷಿಯೇಟಿವ್ನ ತೊಗೊಂಡಿರೋದು ಆಸ್ಟರ್ CMI ಹಾಸ್ಪಿಟಲ್ ಆ್ಯಂಡ್ ಫಸ್ಟ್ ಇನ್ ಇಂಡಿಯಾ. ಅದನ್ನೇ ಕೇಳ್ತಾ ಇಟ್ಸ್ ಅ ಬಿಗ್ ಮೈಲ್ ಸ್ಟೋನ್ ಫಾರ್ ಎನಿ ಹಾಸ್ಪಿಟಲ್ ಆ್ಯಂಡ್ ಆಸ್ಟರ್ ಟೇಕಿಂಗ್ ದಿಸ್ ಇನಿಷಿಯೇಟಿವ್ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ನ್ಯೂರೋ ಆ್ಯಂಡ್ ಸ್ಪೈನ್ robotic ಸರ್ಜನ್. ಅದು ಫಸ್ಟ್ ಆಫ್ ಇಟ್ಸ್ ಕೈಂಡ್ ಆ್ಯಕ್ಚುಲಿ ಇಂಡಿಯಾನಲ್ಲಿ ಅಂತಂದರೆ ಇಟ್ಸ್ ಅನ್ ಅಮೇಝಿಂಗ್ beginning, amazing initiative, and also I should also congratulate the doctors as well here. Ontara avaru they are well equipped to use this. So I think ಒಂಥರ ಇಂಥ ಒಂದು ಟೆಕ್ನಾಲಜಿ ಬೇಕು. ಇವಾಗ ಟೆಕ್ನಾಲಜಿ ಎಷ್ಟು ಬೇಗ ಮುಂದೆ ಹೋಗ್ತಾ ಇದೆ ಅಂತಂದರೆ ನಾವು ಟೆಕ್ನಾಲಜಿ ಯೂಸ್ ಮಾಡ್ಕೊಳ್ಳಿಲ್ಲ ಅಂದರೆ ತುಂಬ ಹಿಂದೆ ಉಳಿತೀವಿ ನಾವು. ಹಿಂದುಳಿದು ಬಿಡ್ತೀವಿ ನಾವು. ಸೊ ಹಾಗಾಗಿ ನಾವು ಟೆಕ್ನಾಲಜಿನ ಯೂಸ್ ಮಾಡ್ಕೊಳ್ಳೇಬೇಕಾಗತ್ತೆ. ಎಲ್ಲ ಯಾವುದೇ ಇದರಲ್ಲಿ ನೋಡಿ ನೀವು ಬೀಟ್ ಡೈಲಿ ಲೈಫ್ನಲ್ಲಿ ಆಗ್ಬೋದು, ನೀವು ಅಥವಾ ಫೋನ್ಸ್ ಯೂಸ್ ಮಾಡಿದಾಗ ಟೆಕ್ನಾಲಜಿ ಯೂಸ್ ಮಾಡ್ತೀವಿ, ನಾವು ಕ್ರಿಕೆಟ್ ಆಡ್ತಾ ಇರ್ಬೇಕಾದ್ರೆ ಟೆಕ್ನಾಲಜಿ ಯೂಸ್ ಮಾಡ್ತೀವಿ. ಸೊ ಟೆಕ್ನಾಲಜಿ ಈಸ್ ಇವಾಲ್ವಿಂಗ್ ಸೋ ಫಾಸ್ಟ್. ಸೊ ಹಾಗಾಗಿ ಆ್ಯಂಡ್ ನಿಮಗೆ ಎಸ್ಪೆಷಲಿ ಹೆಲ್ತ್ ಕೇರ್ನ ನಿಮಗೆ ಯಾಕೆ ಟೆಕ್ನಾಲಜಿ ಬೇಕು ಅಂತಂದರೆ ಟು ಮೇಕ್ ಇಟ್ ಒಂಥರ ಎಷ್ಟು ಕಮ್ಮಿ ಚಿಕ್ಕದಾಗೆ ಸರ್ಜರಿ ಮಾಡ್ಬೋದು ಅಷ್ಟು ಒಳ್ಳೆಯದು, ಅಷ್ಟೇ ಬೇಗ ಹೀಲ್ ಆಗ್ತಾರೆ. ಮತ್ತು ಆ ಪ್ರೆಸಿಷನ್ ಬೇಕು ನಿಮಗೆ, ಆ ಅಕ್ಯುರಸಿ ಬೇಕಾಗುತ್ತೆ ನಿಮಗೆ ಹೆಲ್ತ್ ಕೇರ್ನಲ್ಲಿ ಎಸ್ಪೆಷಲಿ. ಸೊ ಹಾಗಾಗಿ ವೆನ್ Aster CMI Hospital is introducing the neuro and spine robotic ಇದನ್ನು so I think it's a great relief. I'm sure ಖಂಡಿತ ಯಾರ್ಯಾರು ಸಫರ್ ಮಾಡ್ತಾ ಇರೋ ಅವ್ರಿಗೆಲ್ಲ ಗ್ರೇಟ್ ರಿಲೀಫ್ ಅಂತಾನೆ ಹೇಳಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ.
ಸರ್, ಎಲ್ಲ ಒಂದು ಕಡೆ ರೋಬೋಟಿಕ್ ಬಂದ್ರೆ ಕೆಲಸ ಕಡಿಮೆ ಆಗುತ್ತೆ ಅನ್ನೋ ಒಂದು ಮಾತಿದೆ. ಸೊ ಇವಾಗ ಅದನ್ನು ಒಂದು ಕಡೆ
ಅಲ್ಲ, ಆವಾಗಲೇ ನಮ್ಮ ಡಾಕ್ಟರ್ ಸೋಮಶೇಖರ್ ಹೇಳ್ದಂಗೆ ಆವಾಗಲೇ ಮ್ಯಾನ್ ಬಿಹೈಂಡ್ ದ ಮೆಷಿನ್ ಇಸ್ ವಾಟ್ ಇಸ್ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂತ ಹೇಳಿದ್ರು. ಸೊ ಡಾಕ್ಟ್ರು ಆ ಮೆಷಿನ್ ಅದು ಕರೆಕ್ಟಾಗಿ ಆಪರೇಟ್ ಮಾಡಬೇಕು ಅಂತಂದರೆ ಅದ್ರ ಹಿಂದೆ ಡಾಕ್ಟರ್ಸ್ ಇದ್ದಾರೆ. ಸೊ ಅವರು ತುಂಬ ಮುಖ್ಯ ಆಗ್ತಾರೆ. ಕೆಲಸ ಕಡಿಮೆ ಆಗತ್ತೆ ಅಂತಲ್ಲ, ನಿಮಗೆ ಆ್ಯಕ್ಚುಲಾಗಿ ಎಷ್ಟು ಬೇಗ ನೀವು ವಾಪಸ್ ಬರ್ಬೋದು ನೋಡಿ, ಅದು ಬೇಕಾಗತ್ತೆ. ಇವಾಗ ಮುಂಚೆ ಎಲ್ಲ ಮಾಡ್ತಾ ಇದ್ರಲ್ವ ಆಪ್ರೇಷನ್ಗಳನ್ನ, ಸೊ ಅಲ್ಲಿ ತಿಂಗಳಾಂಗಟ್ಲೆ ತಗೊಳ್ಳೋದು ವಾಪಸ್ ಬರೋದಕ್ಕೆ. ಸೊ ಇವಾಗ ಜಸ್ಟ್ ವಿದಿನ್ ಅವರ್ಸ್ ಆರ್ ಪ್ರಾಬ್ಲಿ ಡೇಸ್ನಲ್ಲಿ ವಾಪಸ್ ಬರ್ತೀರಾ. ಆ್ಯಂಡ್ ವೆನ್ ಯು ಹವ್ ಗಾಟ್ ಸಮ್ ಗ್ರೇಟ್ ಡಾಕ್ಟರ್ಸ್, ಡಾಕ್ಟರ್ ಸೋಮಶೇಖರ್ ಆಗ್ಬೋದು, ಡಾಕ್ಟರ್ ವರ್ಮಾ ಆಗ್ಬೋದು, ಆ್ಯಂಡ್ ಸೆವೆರಲ್ ಅದರ್ ಡಾಕ್ಟರ್ಸ್, ಅಂಥವರೆಲ್ಲ ಇದ್ದಾಗ ನಿಮಗೆ ದಿ ಒಂದು ಸರ್ಜರಿ ಇಸ್ ವೆರಿ ಮಿನಿಮಲಿಸ್ಟಿಕ್ ಆ್ಯಂಡ್ ಅಷ್ಟೇ ಬೇಗ ವಾಪಸ್ ಪೇಷಂಟ್ಸು ಅವರ ಒಂದು ನಾರ್ಮಲ್ ಲೈಫ್ಗೆ ಬರ್ಬೋದು. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ಟೆಕ್ನಾಲಜಿನ ನಾವು ಬಿಡೋದಕ್ಕಾಗೋದಿಲ್ಲ.
ಸರ್, ಒಂದು ಕಡೆ ರೋಬೋಟಿಕ್ ಸರ್ಜರಿ ಅಂದ್ರೆ ಒಂದು ಸ್ವಲ್ಪ ಕಾಸ್ಟ್ಲಿ ಇರುತ್ತೆ. ಸೊ ಇಂಡಿಯಾ ಅಂತ ಒಂದು ಮಿಡ್ಲ್ ಆಫ್ ಕಂಟ್ರಿಗೆ ಹೇಗೆ ಅಫೋರ್ಡಬಲ್ ಆಗುತ್ತೆ?
ಅದು ಖಂಡಿತ ದಿ ಹಾಸ್ಪಿಟಲ್ ದಿ ಡಾಕ್ಟರ್ಸ್ ಕ್ಯಾನ್ ಆನ್ಸರ್ ದಟ್ ಕ್ವೆಶ್ಚನ್ ಅಂತ ನಂಗೆ ತಿಳಿದಂಗೆ.
ಹೌದು, ಅಷ್ಟು ಕಾಸ್ಟ್ ಡಿಫ್ರೆನ್ಸ್ ಅಷ್ಟು ಇರಲ್ಲ. ಇದು ಹ್ಯಾಸ್ ದ ಟೆಕ್ನಾಲಜಿ ವಿತ್ ಮಿನಿಮಲ್ ಕಾಸ್ಟ್.